Hello and a very good afternoon to all of those who are watching me live on the Facebook page of News9. I'm Neha Bhan. Today, India has registered yet another spike of over 11,000 cases, of course, for the third consecutive day. Let me just quickly begin by saying, in fact, giving you the information about India's COVID-19 tally. So, the total cases in India stand at 3,32,424, while 1,69,797 people have been discharged. The active cases in the country stand at 1,53,106, which means that India's recovery rate continues to be more than that of active cases. Of course, India's discharge continues to be more than that of the active cases. So the number of deaths in the country also stand at 9,520. But that's not the reason why I have decided to connect with all of you. The reason why I am here is the fact that India's recovery is at an all-time high of 51%. Although India is the fourth worst affected country due to COVID-19, but the country's recovery rate continues to rise steadily, bringing hope for many. Now, what I'm going to share with you is going to, in fact, leave many of you startled. The fact, of course, is that Delhi and Mumbai continue to be the worst affected states in India due to COVID-19. But do remember, the silver lining here is the fact that the recovery rate in these two states is also the highest in the world. So the recovery rate in Delhi stands at 38.36%, while Mumbai's recovery rate, Maharashtra's recovery rate, of course, is at 45.65%. If we have to speak about the five worst affected states due to COVID-19, Maharashtra continues to remain the epicenter of COVID-19 in India with over 1 lakh cases. Tamil Nadu has registered over 44,000 cases. Delhi has registered over 41,000 cases. Gujarat over 23,000 cases. Uttar Pradesh over 13,000 cases. Having said that, do remember that India is doing far better than the worst affected nations when it comes to, of course, in terms of cases per million of its population. So India has registered 233 cases per million of its population, while US has registered close to 6,500. Brazil is at over 4,000, Russia over 3,500, and UK over 4,000 per million population. But having said that, that doesn't really mean, of course, India seems to be doing far better if compared to any other country. But that doesn't really mean that the COVID-19 threat has subsided, or we can take the threat that COVID-19 poses lightly. Do remember that India is the fourth worst affected nation. Now, India is only behind Brazil, United Kingdom, as well as Russia. And of course, in Russia, you have over 5 lakh cases, and India seems to be fast approaching that number. But of course, to speak more on this, I have with me pulmonologist Dr. Satish, who joins me live. Very good afternoon to you, Doctor. Hope you're doing well, and thank you very much for taking out some time from your busy schedule. Now, of course, India has registered over 11,000 cases for the third consecutive day, but that's not why we're discussing it here. The fact is that India's recovery rate is at an all-time high of 51%. Why do you think that India's recovery rate is, at 51%, given the fact that India is a populous country? So what's the reason behind India's, recovery?
Okay. Good afternoon, everyone, and thanks, Neha. And it's an excellent news in the middle of a pandemic where we are the fourth largest, as you gave the world statistic. And Maharashtra, Delhi, Gujarat, and, Tamil Nadu are, having more number of cases. So in the middle of a pandemic, if you have something like 51, it used to be, I think last week, 49%.
Yes.
Now we have crossed 50%. So 51% recovery is a very good news for everyone who is, watching this live. And thanks to the efforts. It's not just easy to have this kind of a recovery. Our population is also different, younger population, less symptomatic. If you see the natural history of the disease, Neha, 85% of patients recover on their own, and they may need, just simple supportive treatment. And 10% of them may require, some, treatment like oxygen and medication. And another 5%, succumb to the disease if they have comorbidities, if they are overage, 65 and above, population. So India mainly consists of, younger population, relatively younger population. That's why the recovery rate is faster. There are many reasons also. We are definitely, different from other population in the world. For example, Italy faced a lot of problem and mortality, because they are elderly population who were affected. And everything attributes to the steps that we took in the beginning of the pandemic. What were those steps? We, advertised everywhere that, do this, social distancing, wear masks everywhere, and then wash your hands. And then lockdown was effective, even though it caused trouble to many people. It definitely gave, time for medical fraternity and the medical facilities to gear up for this. And we were all ready, when the numbers were increasing. And there are many other factors, which are, for example, maybe attributed also to BCG vaccination, which is done in India. So many things have contributed, definitely to this recovery, which is excellent. But you also cautioned, and I also again will caution that it's not the time to relax. It's not the time to go easy on all these, three things. Number one, social distancing. Wear mask all the time. WHO came out just 48 hours before that wearing mask, prevents infection in the community. And also there is a new thing, a new data in US. Neha, I want to share that information that wearing mask at home. I used to say it doesn't matter at home, but now the new data has come. Wearing mask at home also prevented infection if somebody is carrying an infection and he is asymptomatic. So wear mask all the time if possible. Number two, social distancing, as I said, and clean your hands frequently, at least 10 times a day with soap and water. It doesn't mean that you have to use, sanitizers and those kind of liquids which are out there. And and also our behavior is important. The fourth one is attitude is important. The attitude towards, you know preventing this and not to take it easy is important, Neha. And
All
this
right.
has to be conveyed, and as you rightly said, good news of recovery, but the numbers are increasing, so we have to be cautious and careful about this.
Absolutely. So, doctor, of course, China is where the virus originated, is where the, virus emerged from. But China more or less had settled, of course, we did not see many cases arising. Of course, China also said that they're free of coronavirus. The Chinese government, of course, they
Yes.
of course, said that China is now coronavirus free. But the question now is that China is seeing second wave of COVID-19. There are many cases which are rising in Beijing. Mass testing also has been conducted. So the question here is, can something of that sort be witnessed in India? Because of course the ICMR study now, latest study reveals that the cases might continue to rise by October. So after that, are there any chances that India might also get to witness second wave?
Absolutely, absolutely. Even for example, New Zealand, which is completely free, they have also warned them about it. That saying that, don't be, callous, don't take it easy. It may come back, it may sneak in again. This virus is like that. And as you rightly mentioned, Beijing, which has reported more than 50 from one of the markets, again doing a lockdown. So many who doubted, about the lockdown, how it's going to help, or whether it really helped, and those kind of things. If you see the ICMR study which came out 2 days back, and saying that lockdown definitely helped India from 36 days of or 35 days of peak to 76 days, which means we got enough opportunity to prepare ourselves. Definitely lockdown, help. So we cannot be careless here. And ICMR is saying that it's going to be mid-November. The calculations are, these are calculations and projections, and it's going to be mid-November when it is going to be at the peak, when we are going to face problems about ventilator, isolation wards, ICU beds, and facilities, and so on. So we have to be careful. We have to be cautious. We cannot just take it for granted. And
All
As
right.
my good friend, All India Institute medical director, Randeep Guleria said that, we have to take all the necessary precaution that is there. That will not go for a long period of time, and maybe a year or so, which has helped also other diseases, Neha. We were telling our patients about use masks to prevent tuberculosis in the community, don't spit outside, and don't do all these unhygienic things that Indians are used to. And the mask is helping to prevent infection. Hopefully the tuberculosis incidence will come down in India. Mask is there forever. Think like that.
All right. Doctor, quickly, I'd like to
Yeah.
take your word on it. The fact is that Delhi and Maharashtra continue to be the worst affected due to COVID-19. But as per the latest figures that we have with us, the recovery rate in Delhi stands at 38%, 38.36%,
Yes.
while Mumbai's recovery rate is at 45.65%, which is
Yeah.
the highest in the world. So
Yes.
would you be able to simplify these numbers for us? On one side you're saying
Yeah.
that that's the worst affected, these two states are the worst affected, and on the other side, recovery also is like at an all-time high. It's better
Yeah.
than almost all the countries.
Absolutely. And that's why I said, our population, I will attribute to the population, that is, being infected and affected. Our younger population, mainly migrant workers and others who are infected, and generally the elderly people. That is why I think the PM office sent out in the initial lockdown, protect the elderly, protect the old people. I think that has helped. The elderly are staying at home and not coming out, and that is the reason why we have less mortality and more
All
recovery,
right.
of course. And then I've been a part of the mortality committee, and what we have found, those who have died in this pandemic in Karnataka and in Bangalore, many of them, most of them, I would say 80 to 85, 90% of them are elderly, and then they all have comorbidity. So the recovery here is thanks to their age and various other things that I mentioned. If you see, the Kerala recovery rate, especially in Kasargod, was almost 100%. Why that 100% recovery rate in Kasargod was because it was the population, the younger people, the software engineers, the students who all came from outside India, and they recovered completely. There were only two people who were 60 and above. So the population is more important here who are infected. So
All right.
ultimately, as you asked me, how do we break this? This is important. Protect the elderly, protect the vulnerable. Who are the vulnerable? Chronic diabetic patients who are uncontrolled, high blood pressure patients, ischemic heart disease patients, those who are immunocompromised for various reasons. These are the people you have to protect them.
All right. Thank you so much, Dr. Satish. It was rather, in fact, a very knowledgeable session with you. Thank you very much for all your valuable feedback. We really appreciate your time. Well, for all of those who have just joined in, hope all of this information was helpful to you. If you like this video, do not forget to subscribe Newsline YouTube, like us on Newsline Twitter, Instagram, as well as Facebook. Stay safe. Remember, COVID-19 threat has not subsided, although we may be on the path of recovery. Thank you very much for watching.